Hi, Jack. How are you today?
Hello, doctor. Hi. Yes, I'm here for my moles, doctor, and I was wondering if you can take them all off.
Okay. Okay. Tell me a bit more. Why do you think that you need to excise your mole?
One of my friends had a mole, and then she just went to have it checked, and then they said it's melanoma, and they have to remove it. And then she had several surgeries, and now she's dead. Uh, and the doctor said that it is because of the sun exposure. And as a child, I was always in the sun, and I was always topless, so um, lots of sunburns. So I think I might actually get melanoma too.
Oh, I can take your point, and I'm really sorry that your friend passed away because of melanoma, and now I can understand that you are worried about your moles as well. But let me reassure you that not all the moles are malignant. Basically, given the fact that you are in your 30s, the majority of benign moles tend to appear in this age, in this range of age. Is that all right? You
Uh,
know what I'm
yes, but would you like to have a look at them, because some of them are
Yeah, yeah, of course, of
quite
course.
big?
Yeah, of course. I'm gonna ask you. May I take a look at it? Okay. Is that
Pardon?
okay with you? I'd like to take a look at your moles first.
Oh,
Is that
yes,
okay with you?
sure, sure, yes, yes. Have a
Great.
look. Okay.
Okay.
Yeah,
Uh,
they're all benign. Okay.
yeah. Which part of your body has been affected mostly?
Well, it's mostly my upper body, but I've got it everywhere. But yeah, mostly my shoulders and back, because of
Okay.
the sun. Yes.
Okay. Well, great. As I can see, approximately all of your moles are well margined, well bordered, and they have similar range of color. Yeah, am I right?
I think so. I can't see my back, but I asked my sister to have a look, and she said she believed that they look all right.
Yeah, yeah, I can see that all of your moles are kind of similar, and that's why I think that I believe that your moles are benign, and excision is not the things that you need at the moment. Is it all right with you?
What can I do then? I mean, just to make sure they don't get any bad.
Yeah.
And I mean,
Question.
you
Yep.
said, and what do you call a bad mole? I mean, it's when it turns cancerous. How does it look like, and how
Good question.
should I?
Good question. I'm really glad that you asked this question. I was about to mention that. You know, I'd like you to take a look at your moles and actually to check all your body on a regular basis. If you notice any change in your moles at that time, we came back and we recheck all your moles again. But the thing that I'd like you to notice is any change in their shapes, any changes in their colors as well. If you notice that they're gonna be kind of with irregular margins, at that time we need to reassess them, and also if they're getting kind of become itchy. These things are the things that I'd like you to take care and check your moles regularly to make sure that everything is okay. What do you think?
Well, they itch all the time.
Oh,
They're
but
i- they're 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 itchy
ah,
all the time. But
really? It took too long. Okay.
okay. Right. And so, doctor, what can I do to prevent this? To prevent my moles getting
Yeah.
cancerous?
Regarding the prevention, firstly, I'd like you to protect your body against the sunlight. For that, you can wear a hat and long-sleeved shirts to cover all your body. Is that okay? Uh,
Yeah, it might be
and
difficult, but yeah, okay.
Yeah, I know. But secondly, you would need to use sunscreen cream for anywhere of your body that is exposed to the sunlight, like your face or hands,
Right.
and refresh it every 12 hours. Is that all right?
Every 12
12,
hours?
12 hours.
Okay.
Is that all right?
Okay.
And as I said, recheck your skin for any changes. So the sooner we notice any change in your skin, the better diagnosis,
Okay.
the better prognosis will be. And
Prognosis.
and also it would be a good idea to take a photo, so that we can compare your moles after work to find out any changes in the appearance or size or shape and something like this.
Right.
Is there anything else? Would you like to ask?
No, that's it. Thank you, doctor. Thank you. Okay, we overran about 2 minutes, 1 minute 45 seconds. Okay, how did that feel?
That was better, but I don't have time, so like my examination, like my test, I think um, I didn't so good.
Uh, why, I think you did well, actually. You covered everything. Okay. So, what was your feeling? Was it that it was good?
Yeah,
Okay. What mark would you give yourself?
good. 7.
Okay. Uh, okay. So what went well?
Um, well, the first one, I think the Ice Explorer was better in this case.
Okay.
Um,
Yeah, beginning from the start, your rapport was okay. Your information gathering, which I would have some discussion later. But yeah, exploring the ice, that was very good because you explored why the patient is concerned with the moles, and you did that. Okay, and the expectation was to remove all the moles. Okay. Right. It was a structured. I agree. That was very good, and information giving was also good. What could have been done differently?
uh, I think information giving and information gathering, because at first I didn't tell the patient that I'd like to take a look at it. I start to give him some information about the possibility of malignancy, and then um, and that was not good, I think, because the patient asked
Uh,
me to take a look at the mold.
Yes, I mean, based on the case note, the role play, it's telling you that they're benign and you don't need to do anything. But in reality, you need to check the patient. You need the facts before saying that they are all benign. Okay, so when we are gathering information, we need to establish facts. Okay, so gather as much evidence as possible, and that would be okay. So, apart from sun exposure in the childhood, you didn't ask about his sun exposure now. What does he do? Do you work outdoors? And do you use any sunscreen? Also, do you have any family history or family? This was your friend, but how about family? Okay, so and some other risk factors, but the most significant is sun exposure. Okay, uh, good. So what else? And you showed empathy, which is very good. You said that you understand why he's worried. Uh, mm, uh, yes, you said in information giving. What was it that you think you could do differently?
I think I could do it more organized because it actually take all my time, and I think I make it too long. I made it too long. Yeah.
Doesn't matter. You don't have to. I mean, in the new exam format, you don't have to finish all the task. As long as and you were doing a proper consultation, you covered everything till giving information. But something which you could do probably a little bit differently was that to say how much he knows. About malignant melanoma and basically the fact that you can't say that everybody who catches melanoma dies. No. If melanoma is diagnosed early, it can be removed and it is cured. It is cured. Okay. Uh, the other thing is, uh, you said that, well, you don't need to take them all off. Why?
Mm, because they are benign.
Okay. Uh, so, what if I say it doesn't matter? I just want them removed.
Every surgery has its own risk.
Okay. So, surgery is risky, when anyway, and it leaves the scars. Uh, okay. What else? It doesn't actually doesn't uh, stop melanoma. Okay, you might have all your moles removed, you might still get melanoma. Okay,
Yeah.
and basically we wouldn't know where to look, so and where to check. Okay, so basically one. So his idea is that if you remove all of them, you won't get melanoma. That was the idea. So that's why he thinks it's better to remove all of them. Removal means cure. Okay, but it's not the case. Basically, so first of all, it has its own risks. It leaves scars and it doesn't actually stop melanoma. Uh, okay, you mentioned the ABCDE system. Yeah, did you say that?
No.
Okay, asymmetry, you did, and but yeah, to be aware, to be asymmetry, border, uh, color,
Really,
uh,
I didn't.
and diameter, and um, diameter, and evolving. Okay, So it's said here that uh, asymmetry, irregular border, different coloring, increasing diameter, change in shape and size. Okay, which is we call it asymmetry, border, color, diameter, and evolving or changing. Uh, okay, right. Uh, Diameter of over 6 or changing diameter. Okay. For border, you did say irregular border. You can also say ragged border, okay? Or if you can say, you say it doesn't have a clear border with no clear border. So as long as the border is clear, that is fine. If it's symmetrical, it is fine. If the color is one color, it is fine. But if there are different colors in a mole, yes, we need to look at that diameter of 6 millimeters, or if it's getting bigger, and evolving, it means changing. Okay. Uh, uh, so how do you pronounce this?
Changes.
Yes, changes. You said changed. That's difficult to say. Yeah, just say changes. I'd like to. You said several times. I'd like you to do what I'd like you to do. Well, uh, uh, it's this would be doctor centered. Okay, um, uh, this is a doctor centered approach. We tend to say what we suggest or what we recommend or what is recommended. Okay, that is even a better one. What is recommended, okay, is to do this and that. Okay, uh, so that would be the recommendation, and you're not telling the patient what to do, but it's just a recommendation which is there. It's a fact. Okay. Um, so where did you get the 12 hours from? For sunscreen, for sunblock.
Yeah, it was it was got instinct.
Uh, it's that would be probably an SPF of 200 or something like that. Uh, well, and a usual sunscreen needs to be renewed every, I think it's every half an hour or every hour, something like that. Uh, it depends on the SPF. I don't exactly know, but I think an SPF of 30 would be every hour. Uh, okay.
Really?
Yeah, you can check it. You can search it. Okay. I think you did well. You uh, yeah, you just you could say just a little bit more about why we don't remove moles. And then you said, you said you suggested that what we could do is to take a photograph, because you say you can't see your back, and then take a photograph again, review in 6 months, and take another photograph and compare them. But in the meantime, you can actually have this. I usually even give them a handout and explaining all of these. There is a handout, a patient information leaflet you can print and hand into patients. Okay. What's happening? Is that your cat?
Yeah.
Wants to come in.
She firstly tapped the door and then go around, and now she's behind the window and watch inside the room. Beg me to open the window to let her come in.
And they're jealous.
Yeah.